Coronavirus impact here in the state of Nebraska. Governor Pete Ricketts is taking questions there right now. Let's listen into the governor's press conference.
Scheer, also by Wason Dunn, who is with the American Red Cross, and Jessica Coulterman with Lincoln Premium Poultry. I wanted to again remind people to continue to practice good hygiene and that physical distancing from everybody. Wash your hands 20 seconds, cough into your elbow, and especially if you have those flu-like symptoms, high fever, coughing, stay home, and especially in our areas where we have a directed health measure, everybody in your household needs to stay home too. So please continue to practice all the great things that Nebraskans have done to help slow the spread of virus here in our state. Today, I'm very excited to talk about the relief package that the legislature passed. The $83 million approximately that will be available to the state to be able to fight the spread of coronavirus here in Nebraska. And I want to just highlight that at a time when we know that there is huge partisan bickering in Washington, D.C., and that they can't seem to get on the same page there, here in Nebraska, that is not the problem. I want to compliment Speaker Scheer for his great leadership through this, in shepherding his body to be able to get this legislation passed in really record time, and also the legislature in general for how they work together to be able to get this done so quickly. And I see we're being joined by Senator Coulterman, who's here in the background. Thank you for joining us, Senator. But I really just can't say enough about how well the legislature worked together to be able to get this done so quickly. They could not have done this any faster. They did everything they needed to do to be able to get this done in the shortest amount of period of time. Again, that's just it reflects so well on our legislature here in Nebraska and how they work together to be able to address the needs that people in Nebraska have to get the people's business done. And again, it reflects also just so well on the leadership of Speaker Scheer. So, Speaker, if I could ask you to say a few words about this.
Thank you, Governor. It is my pleasure to be here. I thank the Governor for the invitation. But as the Governor stated, it really wasn't a lot of my leadership. It was the cumulative effect of 49 of us working on a single package, a single goal to try to make sure that the residents of the state of Nebraska have the resources made available to the Governor and all those that are on his team, and those agencies under his direction will have sufficient resources to make sure that what needs to be done is done, and they have the resources to buy whatever equipment, whatever services, whatever labor that is necessary in order to do that. I want to thank my colleagues. They did exactly what we asked them to do. We came up not only with the governor's package, but in conversations with the governor's office and colleagues, we determined that we didn't want to get caught short. We wanted to make sure that the governor and the state of Nebraska had enough resources that it was able to respond to probably other things that are coming down the pack that we're not even sure. We don't know what we don't know. And we want to make sure that we were providing our leadership with enough resources in whatever area they chose that they need those resources to be able to respond adequately to minimize the effect on the health of those in the state of Nebraska and the economy as at large. So with that, thank you, Governor.
Great. Thank you very much, Speaker. Great job. We can do this. All right. Great. But again, great job. And again, you're being modest about your leadership because I know you worked very hard with your members to be able to get this all pulled together, and I really appreciate your efforts to make this happen. And again, I just want to compliment the legislature for moving so quickly on this. And again, it really highlights here in Nebraska, we know how to get things done. When there is an emergency such as we have here, Nebraskans come together, work together, collaborate, and make sure we do what needs to happen to be able to protect the people of the state. So congratulations to you and your members for such great work. Thank you, Speaker. Now the Speaker is going to leave. So a couple other things I want to talk about before we get to our guest speakers here. First of all, there have been some questions with regard to evictions. And one of the things I had said is, hey, look, folks, this is a public emergency. Do the right thing. And I'm very pleased to announce that the Association of Apartments, or the Apartment Association, which represents 46,000 units here in the state of Nebraska, has made an announcement that they are going to suspend evictions due to non-payment of rent for the next 90 days. So again, that is a great example of just Nebraskans coming together and doing the right thing. On top of that, I have signed an executive order that will waive a statute that requires the courts to hear these eviction cases within a certain period of time. And I'm actually, the way it's going to provide that relief is for folks who are potentially being considered for eviction for non-payment. It will push that date out past May 31st and could be extended further. So what that will mean is I'm waiving a statute that requires those court hearings to be done within the short time period that was out there. It's pushing it back till after May 31st. It is important to note that this is really about targeting those people who have been impacted by the coronavirus. So the effective date is March 13th, when we did the emergency, and it applies specifically to people who have been impacted by the coronavirus, whether you've lost your job, or maybe you've been sick, or maybe you've got kids at home so you can't go to work. So we don't want people who are being impacted by this virus being evicted. So we are waiving that statute that requires these things to be done until after May 31st to provide that relief. And it's also important to note that this does not apply to people who are involved in, say, criminal activity. It does not apply to people who are vandalizing the units, because that presents health and safety issues for the other tenants. This is specifically about people impacted for coronavirus, and waiving that effective March 13th, waiving the statute so that those do not have to be heard until after May 31st, and of course that could be extended down the road as well. So that is the executive order that I signed this afternoon to be able to address the issue around evictions. But again, as I said, with the Apartment Association, they are taking steps already with their members to be able to do their part during this emergency. So I want to thank everybody for that. As of this afternoon, we have now 66 cases of confirmed coronavirus here in the state of Nebraska, including some additional community spread cases. And so my department will be working on, or is working on right now, another directed health measure that will include Dodge and Saunders County, as well as Lancaster County. And also, in the past, what we talked about is doing this regionally based upon educational service units. But with the Commissioner of Education effectively talking with the superintendents about really saying that there's very little likelihood that you're going to be back this year. In fact, schools should really plan that they're not going to have the rest of the school year this year. That in consultation with him, what we have decided to do is change that geographic designation to be involved around our public health departments. Frankly, they overlap the ESUs very closely anyway. It's a little bit cleaner because it really sticks to specific counties. It'll be a little bit easier for us to administer. And so as part of our DHM, we're going to move the Washington County DHM that was part of the Douglas County area into the one that's going to include Saunders and Dodge County, but it won't fundamentally change what is already implemented in Washington County. But that'll be a part of that new DHM when we get that done. Also, we're going to be, as part of the DHM, again, updating it to say that elective surgeries are prohibited in those areas where we have a DHM, that directed health measure. And again, that's going to do several things. It's going to make sure that we can take those emergency or those operating rooms and turn them into intensive care unit rooms. It'll give us the access, for example, to the ventilators that are in those rooms. It'll help save personal protective equipment like masks and gowns. And it will also be able to allow us to free up staff who are normally working in operating rooms and be able to repurpose them to be able to help with the coronavirus. So again, additional surge capacity for our hospitals. So that is one of the things we're going to be working on later this afternoon, so stay tuned for that official DHM that comes out later today. Also, one of the areas that we know has been impacted is the American Red Cross. The American Red Cross had literally thousands of blood drives scheduled across our country that have been canceled because of the coronavirus. However, the need for blood has not lessened because of this emergency. And so it's important that we not run out of blood. The American Red Cross supplies so many folks with this life-saving resource We need Nebraskans to step up and donate blood. Now, my wife, the First Lady, has already donated blood. We are doing our own state blood drive March 31st. We're just going to do it over at the 1526K building. And it'll be from 2 to 6 p.m. in the developmental area there. So we are going to do our part here at the state to get our teammates engaged in donating blood. And we're asking all Nebraskans to be able to make that appointment, go in and donate blood. The Red Cross is critically short of blood supplies. We need to step up to be able to help them out so they can continue to provide that life-saving resource to our fellow Nebraskans in need. And with that, I'm going to go ahead and call up Wason Dunn, who's with American Red Cross here in Nebraska, to say a few more words about that. Wason?
Thank you, Governor. Thank you very much, Governor Ricketts, both for giving me the opportunity today to get this life-saving message out to the public, but also for everything you are doing to help us and our state get through this healthcare emergency. Thank you also for what you just said about encouraging people to donate blood, and also for the press statement that you issued yesterday encouraging Nebraskans to donate blood. The American Red Cross is already seeing positive results from that, so thank you. I want to start my remarks with a message for everyone who has been impacted by the coronavirus. On behalf of the American Red Cross, if you or someone you know has been infected with COVID-19, or if you or someone you know is suffering economic fallout because of the healthcare emergency, please know our hearts go out to you, and you are in our thoughts. This is a serious situation. The American Red Cross supports and embraces the idea that we're all in this together, and we must all take some extraordinary measures right now to help mitigate the effects of COVID-19. In recent days, we've all learned about the importance of flattening the curve and how that will help prevent our healthcare system from being overwhelmed by the number of COVID-19 cases. It's important to remember there's something else equally important to prevent from being overwhelmed, and that is our state and our nation's blood supply. If the need for blood exceeds available supplies, we will have yet another healthcare crisis on top of the COVID-19 emergency. We are already starting to see shortages. Governor Ricketts mentioned the fact that nationally we have seen blood drives canceled. We have actually seen about 7,000 blood drives canceled, resulting in approximately 200,000 fewer collections of blood. Here in Nebraska, approximately 150 blood drives have been canceled, resulting in approximately 4,000 uncollected blood donations. As the COVID-19 healthcare emergency continues, we anticipate these numbers will grow. And that's why I'm here today to deliver this urgent plea. A shortage of blood could potentially impact patients who need emergency surgery. It could also impact individuals who have been injured in car accidents or other accidents, and it could impact cancer patients who need blood on a regular basis. Here in the United States, someone needs blood every 2 to 3 seconds, and every pint of donated blood can potentially save 3 lives. It's also important to note that the donation of blood and the collection, processing, and delivery of blood have been deemed essential services by a number of different agencies. Additionally, the United States Surgeon General, the Department of Health and Human Services, and the Centers for Disease Control have all issued calls in the recent few days asking for the continuation of blood drives and blood donations. It's also important to know that we in the Red Cross are taking extraordinary measures to ensure the manner in which we collect blood remains safe and to ensure that our blood drives are conducted in accordance with the guidelines for social distancing. I also have here with me a statement issued by the Federal Food and Drug Administration just a few days ago. I want to read just one sentence from this statement from the FDA, and I quote, "People who donate blood are equivalent to those people who are working in a critical infrastructure industry. The reason for this statement from the FDA is that our blood donors and our workers and staff who are collecting, processing, and delivering that blood have a direct link to our nation's healthcare system. In fact, our blood donors and American Red Cross workers are part of the nation's healthcare system because we are delivering the blood that our doctors and nurses need to save lives. So that's why I'm here today to encourage you to donate blood and to let everyone know the Red Cross has implemented additional safety measures to ensure that blood drives continue to be safe. So if you are a blood donor or you are a member of an organization that sponsors blood drives, please keep doing that. And if you've never donated blood or your organization has never sponsored a blood drive, please consider doing so now. Healthy individuals who are eligible to donate blood can go to redcrossblood.org and make an appointment to donate blood right now and find out where the nearest blood drive is. Organizations that wish to host a blood drive can also go to redcrossblood.org and apply to host a blood drive. So, in closing, on behalf of the American Red Cross, I want to thank all Nebraskans for everything that they are already doing to help us collectively get through this healthcare emergency. And yes, we are asking you to consider doing one more thing, and that is to donate blood now and throughout this healthcare emergency. So thank you again, Governor Ricketts, for inviting me to be with you today.
Great, thank you very much, Wason. And I will be there to donate blood on March 31st. So you'll have some of my blood for that too. So, all right, great. And then I would like now to call up Jessica Coulterman, who is with Lincoln Premium Poultry. Yesterday, we signed the proclamation for Ag Week. We talked about how our food supply chain here in the United States is the strongest in the world, that Nebraska is a critical part of that. Our farmers and ranchers do a wonderful job making sure that we are feeding our state, our nation, and indeed the entire world. Steve Wellman, our Director for Agriculture, yesterday talked about how his inspectors were out there making sure that they were doing their job so we can continue to provide that food supply chain. And our folks that are involved in the food processing industry are also doing their bit to make sure we have a strong food supply chain here in this country. And in fact, USDA Undersecretary Greg Ibaugh, who by the way is a fellow Nebraskan and my previous ag director, said earlier last week that USDA inspectors will continue to be on site in our food processing facilities to make sure that those facilities continue to operate. One of those operations is Lincoln Premium Poultry and Costco in Fremont. Jessica Coulterman is going to talk a little bit about what they are doing to make sure they continue operating and keep their folks safe, as well as continue to produce safe and healthy food. With that, Jessica.
Thank you, Governor Ricketts, for the opportunity. I want to just talk a little bit about what we're doing to support our people during this time and to share just what they are doing to keep providing food for you and your families. We have a policy, and we've always had this policy, that if you're sick, you need to stay home. And of course, in any industry, you're concerned for your people and you want them to take care of yourself. And we have a nurse on staff, and we talk to our people constantly about what their needs are and how we can support them in that. So we have constant communication occurring in our organization. We have a formal communication that's going out every other day, communicating with our employees about what we are doing as a company and how we are there for them, and if they have any questions, where they can direct those questions. We've also put together a COVID-19 task force of our key leadership to continually monitor these issues and adjust and make changes as we need to. Like most businesses, we are doing additional cleaning in all of our commons areas and a deep cleaning when necessary. We've made changes to our break rooms and our cafeteria services. We're trying to do some things to keep the morale up amongst our people who are coming in during this difficult time. Tomorrow we'll be providing them with free packages of chicken to take home to their families. And our partner Costco has offered some special shopping times early in the morning for our employees as well to come in to the store. I've had a lot of questions about USDA and their partnership with us as a food processing company. I can tell you that in our building, our USDA partners are 100% committed to what we're doing, and they have expressed 100% commitment in being there and doing it with us. They've had great communication with us as well. The USDA had put out a statement. I'll just quote one sentence. Our agencies are prepared to utilize their authority and all administrative means and flexibilities to address any staffing considerations. And in our conversations with our partners, what that means is they're going to be there to be with us as we communicate and stay open as long as we possibly can, and hopefully never have to stop producing food for our country. I've had questions about what would happen if we had a confirmed case of COVID-19 in our facility. First of all, we would work with our partner USDA and also the local health department in the state of Nebraska to determine what the best steps are for our employees. Most likely, we would figure out through their investigation who our employee had direct contact with, and we would quarantine all those individuals. Additionally, we would do the deep cleaning that other businesses have done, and we already have a company lined up in case that were to happen. We also continue to have strong communication with all of our partners in our company, all of our team members, making sure that they know what's going on and making sure that we are in full transparency with the people within our organization. I'd like to tell you a little bit about our people. They are truly resilient. In the last year, they've been through a massive opening of this new business. We've grown from about 40 employees to about 1,000. They have been through a flood that none of them have seen in their lifetime, and now a pandemic. They are true Nebraskans with a lot of grit, and they've really been unflappable in what they have experienced. Our absenteeism is normal. We have not seen any more people out of work than we would on any given day. They are excited to be there and excited to be part of the solution. They're very proud of the work they do. I got to announce to a group of new employees, we do a question and answer when they start. One of the first questions I got is, are you going to be closing? Are we going to close? Is this going to make us not have jobs? And we said, no, we're an important part of the food supply. We're going to stay open. And the whole room burst into applause. They want to be there, they want to work, and they want to provide food for you and your families. We appreciated the remarks of U.S. Secretary Sonny Perdue. He gave a shout out to the people who are working in food processing. We also received a really nice note from Executive Vice President of Costco, Ron Vacris, who, after viewing Sonny Perdue's video of support, sent it to us to share with our employees saying, that's you and your team. I'm proud of you. So I'm happy to answer any questions, but we are prepared to work through this. We are prepared to continue to put food on your table, and we're just happy to have the support of the people in the state of Nebraska. Thank you.
Great, thank you very much, Jessica. And again, another example of a great Nebraska organization that is taking steps to meet the challenge that we have here with this health emergency. So thank you very much for all your efforts to continuing to not only keep your people safe, but also make sure you continue to feed our state, nation, and indeed the entire world. So thank you, Jessica. Now, as always, actually, before we get into Q&A, I got a couple other things I want to hit upon. One, the Attorney General has asked me to remind people that price gouging is prohibited, and he is working with organizations like Amazon and Facebook. So apparently you can sell stuff on Facebook? Okay, so I'm not a Facebook aficionado, but apparently that's one of the organizations he's working with. Anyway, to remind people that price gouging, even gouging prices online, is prohibited. So please be aware of that. And then also, I wanted to make people aware that Thursday night on NET, our Chief Medical Officer, Gary Antone, our Commissioner of Education, Matt Bloomstead, and myself will be on a televised town hall. And so you'll be able to submit your questions ahead of time for that. So that will be Thursday night from 7 to 8 p.m. So if you have questions, please submit those ahead of time. Now we're going to go ahead and go into the questions that were posed to us ahead of time. So from Nancy Gardner of the Omaha World Herald, what are the governor's reasoning for not requiring closure of businesses such as, she's talking about things such as the salons and the massage parlors and the tattoo parlors and so forth, upon contact closer than 6 feet. And folks, what I want to get at, the idea of the 6 foot is really about how we want to slow the spread of the virus. So again, that's part of the physical distancing we want to do. It is understood that some businesses, like say giving blood, require that you have to be closer than 6 feet. We are not trying to shut businesses down here. So if your job involves being closer than 6 feet, that's okay. The point is we're about limiting large public gatherings. 10 people, that's the 10-person rule. We want everybody to remember, 10-person rule. That's what really matters. The overall big scheme here, folks, is to slow the spread of the virus. If you have a job where you have to be closer than 6 feet, we still want you to take the common sense, good judgment steps you need to do to make sure you're slowing the spread of the virus. So think about, how do you sanitize your work area? How do you make sure that if you can spread people out, spread them out? It is not about shutting businesses down. And then the second question was, will the governor push for financial help for this type of, for self-employed people who have lost their income? And in fact, that's one of the conversations I had with the vice president last week when we were talking about what we were doing with regard to unemployment insurance and waiving some of the regulations. For example, last week we waived the requirement to wait a week. We waived the requirement that you have to be looking for a job and able to take the job. Obviously, that's not the intent of what we're trying to do. We're trying to make those benefits more broadly available during this emergency. So I had the conversation with the vice president last week based upon a lot of the feedback we got that as they look at future relief packages, they should be thinking about what are they doing for the self-employed. Now, having said that, the Small Business Administration declared Nebraska a disaster last Friday, which opens up the opportunity for the small business loans. It's at sba.gov/disaster, and you can apply for those loans as a small business. They're 30-year term loans, 3.75% interest rate. Again, you apply directly with the SBA to be able to do that. Up to $2 million, again, based on your financials. So that's some of the relief that's out there available. I know that the stimulus package that the Senate is working on as we speak also has additional things in with regard to loans for small businesses through the Small Business Administration. So there are some things specifically for those people who have their own business. And as I've said, and I heard on the news that they're going to be expecting another package down the road at some point. I will continue to encourage the administration to include upon that specifically things for people who are self-employed and also people who are contract workers as well. From Andrew Zaki at KETV, there are over 24 counties that have no hospital beds available. How will people be treated in these counties if bed capacity in other counties becomes overwhelmed? Well, this is not a new issue. When people in those counties need hospital treatment, they go to other hospitals to be treated. And with regard to how we view the entire state, again, we are working at the state public health department with all of our local public health departments to be able to make sure we're working together with regard to how we have the hospital capacity to treat the people that are going to need our help. So again, this is the whole point of why we're trying to slow down the spread of the virus, right? So that we don't overwhelm our healthcare system. And folks, we all wear the same jersey. We're all on the same team. So we are going to work to make sure that if in one area we have hospital beds that are being taken up, that we can shift the people who need that help to someplace else that does have the hospital capacity available. And frankly, this is not new either. This is something that happens on an everyday basis in Nebraska already, where healthcare professionals work together to make sure that folks who need that help can get that help. I'll give you a great example. We had our young 16-year-old from Knox County who was first diagnosed in South Dakota and then was sent to Omaha to be watched. So that's an example of how we move people around to where the resources are to be able to make sure they get taken care of. Andrew also asked, could we use empty dorm rooms, hotel rooms, arenas if we run out of beds? Is having enough medical staff and equipment of a greater concern? So we are looking at other alternatives on how we can expand things. We're looking at options to be able to expand quarantine space, using things like potentially dorm rooms or hotels. I had a conversation with the Army Corps of Engineers last week. They've got a program that can turn hotels into hospital rooms. Frankly, right now, what we're pursuing first is looking at space that is already hospital space or with very little effort can be made something that could handle this. And thus we had the conversations yesterday with our CEOs from Bryan and CHI about what they're doing, and specifically how Midlands and St. Elizabeth has rooms available that the state are investing in to be able to bring them up to speed to be able to handle these cases. So we're starting with things like that, but we are looking at other options to be able to bring it up. And again, this is why we're also prohibiting elective surgeries in our DHMs, because that will free up that staff to be able to help with coronavirus. So again, trying to look to see how we can surge all this capacity to be able to help the people who are going to need our help. His final question was, your travel warning is voluntary right now. What could change that? What are the legal or civil ramifications if you violate self-isolation when you return and have been found to have COVID-19? So again, Nebraskans have been doing a great job of following the 10-person rule, of voluntarily complying. We're getting almost universal compliance on this. And again, when we put out these guidelines, what we're looking for people to do is voluntarily do this. We're not looking to be heavy-handed. We want people to do the right thing. Nebraskans have been stepping up to do the right thing. And our final question that came in ahead of time was from Don Walton of the Lincoln Journal-Star. What is UNMC telling you about the anticipated trajectory of the virus in Nebraska? How many Nebraskans may be infected, when the outbreak may reach its peak in Nebraska, and when it might be over? So we have been working with UNMC going back several weeks ago around the profile of what this looks like. With this virus and the information we know right now, we think about 5% of the people who get it will need a hospital bed. We think 1% to 2% will need an ICU room, and maybe 1% will need a ventilator. And so what we're doing is taking a look at that and doing our own modeling with regard to our current hospital bed space, how we can surge some of this capacity to see how that would be. Now, part of those models was based upon what happened a century ago, going back to the pandemic we had with the Spanish flu. And at that time, it was looking at a 30% compliance rate. Well, we know we're way above a 30% compliance rate with the directed health measures and the 10-person rule and all the other things we're doing right now. So we know people are doing the right things. So we are slowing the spread of the virus here in our state. The virus appears to have a community attack rate of 30 to 40%. But we also know that's left unchecked. And we know we're not unchecked because we just talked about all the great compliance we do have. So we are working on those models to see what our hospital capacity would be. We'll be using that as part of our plan. And again, with the resources the legislature has provided, we will be able to take a look at how we can expand that staff, how we can expand buying PPE, that personal protective equipment, how we can expand testing, how we can support UNMC in doing their operations, how we can make sure in general we're prepared to be able to handle the people who are going to need our help when they're most severely impacted by the coronavirus. And with that, I'll go ahead and open it up to, actually, Taylor, I'm going to go to questions that are maybe texted in.
Yep, I have a few things. Number one, the hours for the blood drive are 8 to 2.
Hours for the blood drive, 8 to 2, thank you.
Julie Cornell asks, given the fact we're facing a public health emergency, why not expand Medicaid immediately?
So Julie Cornell says, given the fact that we're facing a public emergency, why not expand Medicaid immediately? I think there's a big misperception out there about how this actually works. What the people of Nebraska voted on for Medicaid expansion is a completely new population of people we're going to serve. The prior folks on Medicaid are generally women and children, right? They need pediatric doctors. The new population are able-bodied adults. They don't need pediatricians. We have to find new providers to take care of them. Our old system was around enrolling people who were primarily those women and children, about 75% of our Medicaid population. The new enrollment system will have to handle those people who are not part of that. So we have to rewrite our software systems to be able to handle the new population. We're talking about over 90,000 people to be able to do that. That is a huge software project. Not only do we have to do that, but all of our managed care organizations have to do that. And it all has to work together. And by the way, we have to go out and hire people to be able to handle this influx of business. We have submitted our 1115 waiver to CMS, the Center for Medicare and Medicaid Services, in December. We are already far down the path of designing our programs for that 1115 waiver and have their approval as we're moving through this process for those conditions of that 1115 waiver. If we wanted to go back and change that now, we would have to go back to CMS to ask permission to do it, and assuming they were willing to do that, then we would have to start rewriting our entire systems all over again. That would push back the start date past October, because we are in testing right now with our software systems. If we have to go back and rewrite it, we got to rewrite it and retest it. That means we'd be pushing off Medicaid expansion to the end of the year sometime, if not into next year. So it is actually not feasible for us to expand Medicaid and take care of people during this health emergency. The only thing we do is if we tried to change our plan right now was pushing it off even farther. It'd be pushing it farther into the distance. So it's just not feasible to be able to do that.
Julie also asks, federal law recently allowed states to opt in to providing SNAP benefits at the maximum monthly allotment for the duration of the emergency. Is that something we'll consider doing?
So the question was about some of the SNAP benefits and allowing them to do it at the maximum level. I know that we already waived some of the requirements around SNAP and the Aid-Dependent Children Program. Julie, we'll have to get back to you on that one specifically and circle back with HHS to find out what the conditions of that are. Off the top of my head, I'm not familiar with that.